Did my allergies just come back in my 40s? Women oftentimes will feel blindsided in perimenopause. Never had allergies before, and now they're itchy, sneezy, congested, having new onset asthma. Many worry that they're losing it, but there are some biologic explanations behind their experiences. Welcome back to Allergy Actually, where we as three allergist moms and best friends are chatting about the science behind what we experience as, professionals and as friends. And today we are talking all about those hormonal changes, especially focusing in on perimenopause. And also, though, talking a little bit about how other hormonal shifts like puberty, pregnancy, and postpartum are also key times when our immune system may not quite follow the textbook.
This is such a needed topic to talk about. No one talks about this. We're talking about it.
I increasingly am talking about it with my patient. Well, in part because, one, I kind of had this realization in the last 6 months of following all of my colleagues and girlfriends who are practicing medicine in this space and hearing all of the knowledge that they're sharing with us of wait a sec. I've been waking up at 2 or 3 in the morning consistently. I'm having hot flashes the second half of my cycle. My ADHD symptoms have the dial has been turned up considerably. And frankly, what all TMI, but my periods have been, sometimes light, sometimes really heavy. And that inconsistency has never really been a big issue. And so after hearing it enough, I was like, oh, I am 41. Maybe I need to look into this. And so, made an appointment with a colleague, girlfriend who's menopause certified, and talked things through with her, and really got me thinking about how I'm seeing this too in my patients. I see a lot of patients that look like us in my practice that kind of are on this spectrum of allergy and autoimmunity. And we know that hormonal fluctuations are a huge trigger for any type of inflammatory condition to potentially go haywire. Yeah. So I started asking more about it and actually starting to read it a little bit. I don't consider myself a hormone expert. I tell my patients that, verbatim, but I said there are some low-hanging fruit things we can do that may really move the dial in regards to turning down this excess inflammation.
And I think one of the important things to say up front is we're not talking about necessarily doing the labs to see what are your hormone levels. Does a certain hormone level mean that you need replacement? It's not that. It's based off of symptoms. And particularly with menopause, there are validated symptom scores. So what does that mean? Because I have friends who are like, all right, what do I need to do? Am I checking my hormone levels? If my doctor's not checking my hormone levels, are they not doing their job? That's not true. So a validated questionnaire is basically something that asks you questions related to a certain condition and has a scoring mechanism that has been studied to show that if your score is this, then it means this. If your score is this, it means that. Takes me back to those teen magazine quizzes.
Yes, it is the scientific version of those quizzes.
Yeah,
these hours of our lives doing.
So this is better than going to the lab and checking your progesterone or estrogen levels is, for menopause, doing one of these validated questionnaires. So when you're talking about, Kara, for our field is we're asking our patients questions. Are you experiencing increase in these mast cell symptoms? What do you see with your patients mostly? Is it the flushing? Is it the dryness?
So flushing, dryness, increase just in their overall reactivity, especially that second half of the cycle. That is more often what I will hear from folks when and then I'll ask some of those other menopausal, how's your sleep?
Mm-hmm.
Are you having hot flashes? Are you having vaginal dryness or other dryness elsewhere? How are your periods? Are they still regular? Is there fluctuation in how heavy they are or how light they are?
And these questions are very intentional because if you're answering yes to some of these, then it helps us know, okay, you're in this perimenopausal time of your life where we know from data that progesterone is decreasing, estrogen is decreasing. Do you want to share, Kara, what you were talking about with us earlier, outline about specifically with progesterone and estrogen and how those impact mast cells?
Yeah. So I think of estrogen. Well, we know it's a key immune system regulator. And typically, estrogen has an ability to act like a gas pedal for our allergy flavor of inflammation and mast cells. It can increase histamine release from mast cells and increase their activity in a few other mechanisms too. So that's like a gas pedal. Progesterone also can act like the brake pedal. It helps to stabilize mast cells and can help keep them from being so reactive. So if you are living through this roller coaster of symptoms where your body has sometimes both its foot on the gas and the brake, or off the brake and on the gas, or, vice versa, you can see these big swings in how your immune system and specifically your allergy cells are functioning. And we've known since, beginning of our training that there's kind of this rule of thirds that we're taught, that a third of patients with allergies or asthma will have those get worse at times of hormonal fluctuation, puberty, pregnancy, postpartum, and perimenopause. That, if you have someone with asthma, a third of those folks with asthma will get worse, a third will stay the same, and a third will get better. And this holds true across other inflammatory conditions too, like autoimmune conditions like lupus, rheumatoid arthritis, Sjogren's. So what I find fascinating is that even people with the same underlying condition, inflammatory condition, may experience differences in how their body responds during these times of hormonal change.
Yeah, that's one thing that I have started thinking a lot about in younger patients as well, because like you said, we were always taught, and I specifically would always focus on pregnancy. I just remember that number for asthma, that there's, data that shows a third get better, a third get worse, and a third stay the same. So we know that there is clearly something happening whenever you have this hormonal change, but there's honestly not a lot of great research done in all of these other areas. We know that in general, there's a lack of research done for perimenopause and menopause. And there's a real lack of, knowledge in medicine. And one of the things that I always, I've started asking, because I've been having some teenagers. Yesterday I had one and they said, she had had to use albuterol a couple times when she was little, but really she didn't struggle with that throughout the years. It went away. And all of a sudden, the last 6 months, she just started having, all of a sudden she's coughing all the time and has wheezing and has, nasal discharge and itchiness and eye symptoms. And yesterday I said to this patient, I actually said, so can you tell me when you started your period? And I, for a young person, you also have to kind of preface that when I say, I'm sorry, I have a reason for asking this. And they said about 6 months ago. And then mom was like, that's when all this started. And I was like, yes, we don't have, there's not great research that supports that, this definitely does happen in this, like for puberty specifically. But we know anecdotally that it does. We see this. And then also we have that factual information for at minimum asthma and pregnancy. So I think that is something that we as allergists need to be aware of. And then as parents as well, there are big changes that come with puberty. And we all know that, but it could be more than just what you have been taught to expect. And one of the things that fascinates me is that for food allergy studies, looking at natural resolution and things like that, no one has really done studies looking at from childhood to puberty, because I think we would get a lot more answers then versus choosing an arbitrary like age 5 or 10 or whatever. Because I always tell families, once puberty hits, I definitely think we should retest for this. I usually don't retest every food allergy every single year, but definitely if we haven't done it in a while, we need to see where you are once puberty happens, because there are changes and I don't know what to predict. I can't. I just know that things change. Have you guys experienced sort of the same thing or know any, actual facts about any of that I'm unaware of?
I mean, that's kind of our general philosophy that we grow up in allergy immunology talking about, that kind of thing tends to get worse at puberty. And talking about it is so important because patients aren't going to think to bring it up. Like, they're not coming to us saying, hey, you know what? I think that my symptoms are worse because I am in perimenopause, or you know what, I just started my period and I think it's causing this. They're not going to say that. I mean, hopefully our good friends out there in Allergy Actually land are now going to feel confident to talk about it and share this with friends. So the conversation started and maybe you'll connect the dots. But as allergists, that's part of our job, is to help people connect the dots for them, ask the pointed questions to piece that out of the history if it's part of it. I think talking about this is enlightening in that regard, that it's like, for a lot of people, they're going to listen to this and have this light bulb go off and say, oh my gosh, this is my problem. And so the good news is there's something that you can do about it, at least in perimenopause, right?
Yeah. Well, and, I'm just thinking back, not super common, but another topic we're going to have to cover another day is progesterone hypersensitivity. But we kind of will think about, so we've known for a long time that there are some folks that will have increase in their chronic hives or their eczema rashes in that week or so before their period. And then it gets better once their period starts. And so, when we think and learn about that, we think about the whole toolbox that we could use at our disposal. And part of the tools that we discuss with a patient depend on their goals. In regard, do they want to have a baby? Are they done having kids? Do they not have any interest in having kids? And so this is an extension of that conversation. And is there then some potential role for thinking about HRT or hormone replacement? I think the new term might be
MHT, modified hormone replacement therapy.
Yes, thank you. And so, I think that just adds an additional tool to that toolbox and that discussion that frankly wasn't quite a part of my conversations up until recently. And I really give so much credit. If you are out there and you want some great, reliable sources on who to follow on social media, to listen out for, Dr. Heather Hirsch, Dr. Rachel Rubin, Dr. Kelly Casperson. I don't know if you guys have some additional folks that you like to follow, but
Dr. Maria Haber.
Oh, yeah.
She wrote on menopause that talks a lot about the impact of these types of things.
Yeah. And her podcast is really great too. There's an excellent episode I remember listening to. A friend sent it to me and I was like, wow, like so many light bulbs just started for me, personal symptoms and then things that I also see in my patients. So,
and you may decide with your healthcare professional you're working with personally, whether or not, using hormones is something that is a good idea or not. But there are some other lifestyle things that we can do that can decrease allergic inflammation, decrease the overall allostatic load that your body is seeing. So using fragrance-free products, gentle detergents, prioritizing sleep, and making time for yourself, some stress reduction. I'm saying that with some emphasis because I need to hear that right now. And eating a more anti-inflammatory diet and treating your allergies too, getting reevaluated. That's a huge lever to really turn down a big driver of systemic inflammation.
Yeah, that's a good point because things really add up, like they stack, right? You add allergies, there's some Th2 inflammation there. You add autoimmune disease, there's more inflammation. You add, now I'm in some type of hormonal change period of my life, add another stack. And if we can take away layer by layer, you're going to feel better. Even just taking away one thing at a time, treating your allergies, getting, something like intralymphatic immunotherapy to start feeling better faster from your allergies. And then it takes off one layer of symptoms. And then we say, okay, well, that's better. Now I can focus on the remaining symptoms. Maybe that's from my hormone situation right now.
Well, and I know for me, just starting a little bit of addressing my hormones, it has given me so much more bandwidth to focus on my work, to plan out my week so that I have time to work out and meal prep and do other healthy habits that I know like they add up over time.
For sure.
Amber, that was such a beautiful way, I think, to describe the layers. What I try to tell people in my clinic, and it's not necessarily thinking specifically about perimenopausal patients or anything like that, but sometimes people will say, well, will this specific treatment help this other big thing that really bothers me? And I'll say, well, whenever you have issues or your body feels a certain way, it's often multifactorial. So if we can take away at least a few of those things or make better a few of those things that aggravate you on a daily basis, that will help. And it helps with overall health and just feeling better. So I love the way you put that yes, there's this one thing to fix for everything, not necessarily, but fixing that can significantly improve the quality of your life.
It's like the domino effect too, that you hit one thing and then you're able to make all of those subsequent changes afterwards. So in summary, it's not all in your head, it's in your hormones and your immune system. We encourage you reach out to your personal healthcare team. If we can help you with your allergies, we would love to do that. We've added the links to our practices in our show notes as well. And, this is really a call to normalize this conversation that our hormone and immune system health are not two separate silos. You are all one human. So if you found this conversation helpful, we would love for you to share it with your network, share it with your girlfriends, and we'd love to hear your stories in the comments and any suggestions you have for future topics that we can chat about. Till next time, take care.